all for joining us for tonight's discussion on COVID-19 and the vaccine for children ages 5 to 11. My name is Molly Grantham. I'm a WBTV News anchor. I'm also an author and a speaker and a mom. I have 3 kids. 2 are between the ages of 5 and 11 and a baby boy, 2 boys and a little girl. And our whole family actually had COVID back in July of 2020. In fact, my baby at the time was 10 days old and was the youngest presumptively positive COVID case in the state at 10 days old. And we're all fine now, and that's good news. But lots of questions from parents. And I am a parent and I have questions myself. Children are vulnerable to the COVID-19 virus, just like everyone else. And we have seen that COVID-19 vaccines are safe and a tested way to protect people from the virus. We now have a vaccine for children. You guys know that this is an important milestone in the fight against COVID-19. And like many of you watching, a COVID-19 vaccine for children is top of mind for many families. As parents, we want to make the best and the most informed decisions that will best keep our kids safe and healthy. And that is why I am delighted to moderate tonight's discussion from here in Charlotte. But of course, it's a statewide discussion and we welcome your questions. And we are very happy that you are watching and joining us from wherever you are. We're going to start our discussion on the recent recommendation that children ages 5 to 11 can now receive a safe and effective COVID-19 Pfizer vaccine. We know you guys want more information, and our guests that we are really honored to have here can help answer your questions. Tonight's discussion includes a telephone town hall feature. So if you're listening by phone, or if you would like to listen by phone, you can submit your question by dialing the telephone number on the screen. Press 0 on your phone keypad at any time to be added to the queue. We're going to try to answer as many questions as possible. Again, it's an informational, educational town hall tonight for the state. So if you're watching via social media, we are everywhere out there. We invite you to post your questions in the comments box. We have people looking for the comments and looking for the questions to then pass on. Tonight, let's meet our panelists. I am joined by Secretary Mandy Cohen of North Carolina's Department of Health and Human Services. Secretary Cohen has been leading the state's efforts to fight COVID-19 since the beginning of the pandemic. She is a very recognizable face now across our state after the past 20 months. Her team at NCDHHS oversees the public health response to the COVID-19 pandemic. We also have with us Dr. Rasheeda Monroe. Dr. Monroe currently serves as the Medical Director of Primary Care Pediatrics at WakeMed. She is also the Raleigh Area Campus Director of the UNC School of Medicine and the Director to the Keenan Urban Scholars Program at the UNC School of Medicine. Dr. Monroe leads COVID-19 vaccine efforts with the Sister Circle and her health equity team of volunteers from WakeMed. This group of 6 African-American doctors have vaccinated more than 14,000 people from communities where people have been most impacted by the COVID-19 pandemic. So we really want to thank you both of you women, for being here so much. We do want to turn it over to you both to share some remarks of your own. And so Secretary Cohen, we'll start with you. Where do you want to begin?
Great. Well, good evening, Molly. First, thank you so much for moderating tonight. And Dr. Monroe, such an honor to share the Fireside Chat with you tonight. So hi again, I'm Dr. Mandy Cohen. I'm the Secretary of the North Carolina Department of Health and Human Services. And I also am a mom of 2 daughters who are ages 7 and 9. So this is a really important conversation to be having. And I'm really grateful for all of you joining to have this talk on COVID-19 vaccines for our younger children. So we've made great progress in vaccinating North Carolinians since the start of this year. More than 72% of adults 18 or older in the state have received at least 1 dose of a COVID-19 vaccine. And now we want everyone 5 and older to get their COVID-19 vaccine. You know, as Molly said, kids can and do unfortunately get COVID. During the most recent surge of COVID over the summer, where we saw a really contagious version of COVID-19, we saw kids get sick pretty often here in North Carolina. Actually, the number of cases rose by almost 200% here in North Carolina and about 240% across the United States. So we know that we need to continue to protect our children from COVID. We know not only can they get sick, unfortunately, they can also be hospitalized. And sadly, we have lost a few children here in North Carolina to COVID. Now, we know kids do get less sick and less severely sick from COVID, but it still can happen. And importantly, kids can get what's called long COVID, meaning ongoing symptoms of COVID, or something called an inflammatory disease that can happen after you get COVID. So again, vaccines are such an important piece of protection that we can use to protect our kids against COVID-19. As a parent myself, that's why I'm really excited for us to have this conversation tonight. And I do want to share right up front that I vaccinated my daughters, again, who are 7 and 9, this past Saturday. But we want to make sure to answer your questions tonight. It's definitely natural to have questions. We all love our kids. We want them to be safe. We want them to be healthy. And that's why I'm excited to be joined by a pediatrician tonight. That is Dr. Rasheeda Monroe, who's been such a phenomenal leader throughout our response to COVID. And we're going to answer all your questions tonight. So Molly, back to you.
I'm glad you said, Mandy, that it is normal to have questions, because a lot of parents do across the state, and in the newsroom, we hear that all the time. I am going to turn it over now to you, Dr. Monroe, to introduce yourself.
Thank you so much, Molly and Secretary Cohen. I'm really excited to be here tonight with the both of you and to answer questions that parents have. As you said, Molly, I am a pediatrician. I'm also a mom, and I am a mom of an 11-year-old who participated in the Pfizer study, the COVID-19 vaccine study through Pfizer. So he also has an older brother who's 14 who received his vaccine this summer. But we have treated, families and children who have been impacted by COVID disease, and we are really excited as pediatricians to get in the game. I've been helping to vaccinate adults, as you mentioned, over 14,000 doses that we've given with our health equity team over the course of the past many months, but we're really excited to finally be able to be offering this to children.
Let me go over again. So everybody watching, we're getting more and more people to come in right now. But if you are listening or watching through the phone, you can submit questions. So just use the telephone number on your screen. Or if you're watching on social media, post your question on social media. Press 0 on the phone. If you're on the phone, that's the key. Press 0 on the phone keypad at any time to be added to the queue for your question. So let's get started. I'm going to ask you both a couple questions, and then we're going to take live questions from people calling in and people posting on social media. So we'll start, Secretary Cohen, with you. Some of the basics here. I feel like a lot of us have different levels of understanding of the COVID vaccine for children ages 5 to 11. Give us the basic about the recent announcement that now it is approved and COVID-19 Pfizer vaccine is available for kids that age.
Sure. So really important to know that this vaccine that was just recently authorized just last week by the FDA and recommended now by the CDC went through a rigorous clinical trial. As you heard from Dr. Monroe, her son even participated that trial. Some parts of it went on right here in North Carolina. And it is wonderful news that we now have seen this vaccine be tested in our kids. Important to know that the vaccine is a smaller dose of the adult vaccine. So adults can get a Pfizer vaccine, but our 5 to 11-year-olds are going to get about a third of that dose. It is still a 2-dose regimen. So my daughters, for example, got their vaccine this past weekend, and in 3 weeks, they will get their next dose. And again, we had clinical trials, and importantly, the most important takeaway from tonight is that we saw in those clinical trials, there were no safety concerns or serious side effects noted in those clinical trials. We know the FDA looked at that data really closely, as did the CDC. And as I said last week, they recommended that now our 5 to 11-year-olds receive their vaccine. The great news, unlike earlier in the year with adult vaccines, we have plenty of supply for our kids across the state. And remember that COVID-19 vaccines are free to everyone. And again, as a parent, huge relief knowing that we have this vaccine to keep folks healthy.
Well, and Secretary Cohen, let me stick with you on this. Why should parents get their children vaccinated against COVID-19? But also, what do you say to people who have concerns about vaccinating their children?
Sure. Look, I think we all need to remember that while we've been hearing that COVID does impact kids less, I have to tell you, it really does impact our kids. And Dr. Monroe even mentioned in her opening how she's been treating children who have had COVID. We've seen them get pretty sick, get into the hospital, and like I said, unfortunately die, and see some of these long-term effects of COVID. So kids are vulnerable just like everyone else. And I don't want to see any of our kids get sick and have some of those long-term symptoms. And so now that we have this safe and effective vaccine, that is why I want parents to go out and get their kids vaccinated. And like I said, this isn't just talk. I vaccinated my kids just a few days ago, really early on, because I think it's that important. These vaccines, again, went through a rigorous process. And we know that vaccines can get our kids back to the things they've been missing, some of those indoor activities with people and places that they've been missing out on. And so, we just want to make sure that folks can hear from us directly about the science and the data of what COVID does to children, how this vaccine is safe, and how it can protect them.
Dr. Monroe, you said you've been giving the vaccine to kids at WakeMed. What should they expect, a parent, if you're taking your child? What should you expect when you're going to take your child to get the vaccine?
So parents should expect some similar side effects that we've seen in adults and in the older children. A sore arm or low-grade fever, feeling tired, having a headache. That may happen in about 1 to 2 out of 4 people. So less than half of people may feel those types of symptoms. The injection itself is usually in the arm. They can select to have it in the leg. I know most children are used to having their vaccines in their leg. And so if that's what they choose, they can choose to do that if that makes people feel more comfortable. But there have been no significant safety concerns about the Pfizer vaccine, the lower dose in the 5 to 11 group. In the study, we did not see any of the myocarditis risk. I know that's something that people ask me about and sometimes have concerns about. So I think the biggest thing they should expect is to feel relief that they are one step closer to having their child protected and getting back to what feels something like normal for us.
So Dr. Monroe, what do you say to parents who feel like their children have made it this far and they didn't have the COVID vaccine yet, and they haven't gotten COVID? And then on the other side, what do you say to parents if a child has already had COVID-19, like my kids, do they still need to get vaccinated?
We absolutely do recommend that children who either have made it this far or who have already had COVID get vaccinated. We know that the protection from the COVID vaccine is stronger and longer lasting protection than having the infection itself. And children don't live alone. Children live with adults, and they go to school with other children and other people who have, illnesses or immunocompromised, things that put them at risk. And so though children have had, they haven't gotten as sick as Secretary Cohen has mentioned. Children have gotten sick. Some children have even died, unfortunately. But we've also seen children who have had some long-term effects, some neurological problems, or even problems with their memory or cognitive issues after having COVID. So the end point isn't just preventing death, but also preventing the long-term consequences of having the COVID infection itself.
Long-term consequences is something that's starting to get more and more talk about that. As a reminder, for those of you who have questions who are listening in on this right now, you can submit them by using the telephone number on your screen, posting them on social media, or if you're joining us by phone, press 0 on your phone keypad at any time and you'll get added into the queue. So we are going to begin taking your questions in just a moment. But before we do, just one more question for you, Dr. Cohen. Where can parents take their children to receive the COVID-19 vaccine if at any point they decide, yes, this is what I want to go do?
Yeah, great. Thanks for that question, because we really want to make sure that parents know how to, once they make the decision after hearing all of this information tonight, where can they get vaccinated? So kids can get vaccinated at any location that has this smaller dose of the Pfizer vaccine. This could be your own pediatrician's office or doctor's office, a hospital, a local pharmacy like a CVS, a Walgreens, a Walmart, some grocery stores. And we even have additional pop-up sites across the state. The important place you want to go for information is myspot.nc.gov. As I mentioned, there's over 800 locations in North Carolina that are going to carry this smaller dose of Pfizer for our 5 to 11-year-olds. So there's plenty of vaccine. There are certain places that are doing appointments. Some are doing walk-ins, but we encourage you to go to myspot.nc.gov, call ahead, make sure that they have that the child dose of the Pfizer vaccine before you go, but everyone's going to have a spot to take their shot.
Okay, thank you. myspot.nc.gov, just to reiterate that one, that is on commercials you guys might see across the state right now. So we're going to take our first listener question. This is Nicole from Statesville. Nicole, go ahead. What's your question?
Hi, my question is, my daughter is considering taking the vaccine. However, I'm concerned as a parent, just given the long-term possible negative side effects of her future reproductive system. How could you answer that?
Nicole, that is something that we hear a lot in the newsroom. You are not alone in thinking that. Why don't we go ahead and start with you, Dr. Monroe, and then Dr. Cohen, if you want to follow up, if there's anything else you want to say, go that way. But go ahead, Dr. Monroe.
Sure. Thank you, Nicole. Thank you for participating and calling in. And I really appreciate that question. We have heard that question quite a bit. And, unfortunately, I think this is some information, kind of misinformation that's been spread and caused people some concern. The truth of the matter is we have seen no decrease in fertility or issues with reproduction in people who have received the COVID-19 vaccine. Many people who have received the vaccine, even in the adult studies and well beyond, have had normal, healthy pregnancies and fertility. As a matter of fact, we do see in people who have COVID infection an increased rate of miscarriages and issues surrounding that. So that's something to consider. But your reproductive system, your immune system are not connected in a way that would cause any impact at all to fertility or ability to reproduce. And so I think honestly that's something that we can safely say is a hoax and has been some misinformation that's really been that's circulated.
Gosh, never going to have a good Zoom call if you don't mess up the mute at least once, right? The hoax is so it's a hoax. Dr. Monroe, you're saying it's a complete and utter hoax, and that's a pretty clear answer. Dr. Cohen, is there anything else you want to add to that?
I think Dr. Monroe said it well, and I want to reiterate, in fact, the CDC went so far to put out an advisory to say we encourage women of childbearing age, and if you are pregnant, to get vaccinated, because COVID can actually be so damaging both to mom and newborn babies. So we actually are very much encouraging folks to get vaccinated, and folks do not need to be concerned about any long-term repercussions to reproduction. As I said, I have 2 daughters, so it's certainly on my mind. I vaccinated both of my daughters, so I feel completely safe in doing that.
Dr. Cohen, thank you. Next up from the listener calls and questions is Eric from Charlotte. Eric, go ahead.
Yes, thank you for this opportunity. I've got a 2-part question. What is all the side effects for our children taking the vaccine? And also, why isn't natural immunity being part of the discussion like other countries are having?
So let's start with the first question, Eric. Those are 2 good questions. And Dr. Cohen, let's start with you on all the side effects. Please give a list for our kids from Eric and Charlotte.
So the most common side effects are usually a sore arm, feeling achy and tired for about 24 hours, maybe a headache. I will, again, just to share our personal family experience again from this weekend. My daughters didn't mention anything. I didn't ask, but they didn't mention a sore arm. They didn't mention a headache or feeling fatigued. So what I would say is every kid is different. The most important thing you can know is that there were no serious side effects that were reported. It's all of these short-term side effects that do go away within 24, 48 hours. And to address, Eric, your very important second question, which is about natural immunity, meaning you've gotten COVID. As Molly mentioned, her family got COVID. And, having an infection like that does give you some immunity. The issue is it's variable, right? We don't know exactly how your body made its immune response, how it made antibodies to fight off COVID if it would see it again. When we give you a vaccine, it's teaching your body in a very specific and strong way. And it is done through clinical trials and science. So we know how your body is going to make its immune response. And we can also monitor for how long that immune response would last. Every kid can experience COVID differently. Actually, many kids, as we've said, don't get very sick from COVID. So we have more to learn to know about whether or not, if they've had COVID, if it gives them lasting immunity. And that's what we want. We don't think vaccine gives you forever immunity either. But what we do know is that it gives you longer term immunity than does just having COVID. And so that's why Dr. Monroe earlier said, she is recommending to all our patients, the CDC is recommending that even if you've had COVID before, you want to be vaccinated.
Dr. Monroe, do you want to add anything to that about the immunity specifically?
No, I think Secretary Cohen really covered all the important aspects there, so I appreciate that.
Okay. Let's go to a Facebook question, and I'm reading it here through my computer, so sorry that my eyes are down. But to both of you, is there any waiting period between kids having COVID and getting vaccinated? So if a child just had COVID last week, do they have to wait to get the vaccine?
So Molly, that's a great question. Really, people need to be outside of their quarantine isolation period after they've had COVID, and they need to be feeling well. And so for some people, that's going to be 10 to 14 days. For some people, that may be a little longer if they got sicker, but then they should get vaccinated. So there's not a specific waiting period outside of that. Now, if someone were to have gotten monoclonal antibody, which could be available in people who are over 12 years old and have some high risk conditions that make it more likely that they could get very sick from COVID, those people who have received the monoclonal antibody, they should wait 90 days after having received that infusion before getting vaccinated.
Okay, so Eric from Charlotte, I hope the immunity questions have made you feel better about that question. I can say just from a personal experience, my daughter at the time was 9 last July. She's now 10, but she was the first one to get COVID in our family. And if you go back to July of 2020, that was when the state was really deciding, do we go to school? Can kids get it? And there was a lot of indecision at that point. And I, even being in news at that time, will say I didn't think it would be so serious for kids. And she was very sick, and we had a 3-day-old in our house. And she is fine now, but that, she transferred it to all of us. And I do wonder about the immunity for her and also my 7-year-old boy. And of course, the baby's sort of a non-issue at this point because he's not eligible for a vaccine. But you do wonder about immunity, and because they had it bad, are they okay now? And to hear you guys say, no, go ahead and get it because the vaccine is sometimes better than natural immunity helps me as a parent, not necessarily as a journalist. So I just wanted to add that perspective to it. We appreciate your responses, but I want to keep going to other people's questions because we are getting a lot of them. And let me remind you that if you guys are listening on the phone, just press 0 on that keypad to get into the queue or comment on social media through the NCDHHS pages where we're watching this so we can get your comments, and I'm getting them through our people who are monitoring them, and it's a lot of questions. So let's go here. Whew, the questions about masks at schools. Okay, Dr. Cohen, this is from Facebook. Are kids who get vaccinated safer to unmask at school?
I think this is a great question. And what I would say is, as we've been fighting COVID-19, we've needed different kinds of protection. What we've seen from the science and the data, vaccines are the best protection. And now finally, yay, they're available for our 5 to 11-year-olds. So that's, what brings me relief as a parent. But what I would say is that we need to make sure a lot of our kids are getting vaccinated. I do think if you get vaccinated and you need, again, remember it's 2 doses and waiting 2 weeks after your second dose to be fully vaccinated. Yes, that is definitely going to mean your child would have extra protection. And then so those other layers of protection, while important, you kind of now have that number 1 layer of protection. So we are using masks in school right now because as we can imagine, most kids at school are not vaccinated, and it's going to take some time for our kids to get vaccinated. I think over the next couple of months, as I said, it's going to take 2 vaccines and then 2 weeks. And so I think that as we head into the new year, that we can think about different kinds of safety protocols. Right now, I would continue to encourage everyone to layer protection. And so I would definitely get vaccinated. Your kids going to definitely be more protected, but I would keep wearing masks at school until we can get more of our kids vaccinated, and again, fully vaccinated into the beginning of next year.
Dr. Monroe, do you want to add anything to that? Obviously, masks in school have been a big discussion in every single one of the 100 counties across our state.
Sure. I like to think of it like driving in a car and the layers of protection that I would use, right? I wouldn't just rely on my airbag or just rely on my seatbelt. I would drive the speed limit, and I would pay attention to traffic laws. I would have a car with a functioning airbag, and I would wear a seatbelt. I would do all those things to help protect myself. And so I think about that with COVID. I get vaccinated, I wear my mask, I social distance, I do all the things to help add those layers of protection to protect not just myself and my family, but other people in my community who may be more vulnerable than me. And, the other thing we know is that though this vaccine is very effective at keeping people out of the hospital and from dying from COVID, no vaccine is perfect. Even our best childhood vaccines that we all have trusted to give to our children for decades and decades, not one has 100% effectiveness. And so we do have to indeed layer those levels of protection to help protect everybody.
Let me ask a sort of hypothetical question when it comes to masks in schools and kids. There's school board meetings all the time. We're covering them in the news all the time. There's one in Charlotte-Mecklenburg schools tonight, and they're talking about masks. If a child gets fully vaccinated, they've gone through both shots, would that mean that if, from your perspective, I know you guys aren't running school board decisions and each county has been given the power to make their own school decisions for their district, but would that mean, if you would say, in your opinion, if someone is fully vaccinated and they're in school and they are exposed to someone else with COVID, that then they wouldn't have to quarantine?
Well, Molly, that's exactly right, and is already our guidance to school districts. So for our 12 and up who've already been able to be vaccinated for the first few months of school, we have said if the students are vaccinated, yes, they do not need to quarantine, again, because they have a layer of protection in addition to the mask. We also said if you had 2 students who were both masked and the exposure happened, you also don't have to quarantine, because again, we are layering those protections. So the time when you really do need to quarantine is when you do have an unmasked exposure. And again, an exposure means you're indoors within 6 feet for more than 10 or 15 minutes. And again, we know that happens. Kids are having lunch, and there are different kinds of exposures. So even, at school, and we recognize that, but that's why we're trying to, again, as Dr. Monroe said, layer these protections. Vaccine, great. I think our strongest protection. Now all kids can be eligible for that. Masks just provide that additional layer.
And that's a state guidance, and then each county can decide on their school board district at their level what they want to do, but that is the state guidance.
Correct. That is a
Okay.
state guidance, yes.
We have another listener question. Helena from Oasis. Hello, go ahead and ask your question.
Yes. Hello. How are you?
Hi.
I was calling to ask, children with underlying medical conditions, how would that affect them?
This is such a good question, Helena. Children with underlying medical conditions, and obviously there's a wide variety of underlying medical conditions. But Dr. Monroe, why don't you start with that, and then we'll go to Dr. Cohen.
Yeah.
Helena, thank you so much for that question. It's a great one. So children with underlying medical conditions are the children who we really strongly encourage to get vaccinated. Some people wonder, does it, should they not get vaccinated because they may have more trouble with the vaccine? But the truth of the matter, the case is that they are the people who, if they were to get COVID, may have a much tougher time dealing with COVID. They may get much sicker and have to be hospitalized. And so our children with multiple medical problems or underlying conditions, we are strongly encouraging those families and those children to get them vaccinated.
Dr. Cohen, what do you say in response to that?
I think Dr. Monroe, right on the money there. And the other thing I would say is talk to your pediatrician. Obviously, if your children have medical issues, I'm hoping that you are connected into the medical system and have a pediatrician or other medical provider you can talk to and have that conversation. I think it's right to ask questions because, again, I'm sure you want the best for your kids. I think you can hear from both of us about the fact that we absolutely want kids, particularly who have those chronic medical conditions or other things that could make them very sick from COVID, want them to get vaccinated. But again, I think always a good idea to have a conversation with your pediatrician.
We do want to remind you guys, as people are coming in and out of this call, it is 1 hour long. It'll end at 7:30. If you have questions and you're listening on the phone, you can just press 0 on your keypad to get into the queue. If you're watching on social media or some streaming services, put your comments out there. We do have another call, Pat from Selma. Pat, you are on live. Go ahead and ask your question. Pat, can you hear me? We're going to go on, I think, to Facebook, but Pat, we're going to try and patch you in. Sometimes technology does this, as we all know over the past 20 months, the joys of technology. We do want to ask about the risk of myocarditis, right? That's what I always feel like look, I'm human, so I don't pronounce everything correctly, but that has to do with a lot of questions come up about that myocarditis.
Well, I'll start and then want to pass it for sure quickly over to the pediatrician. So first, what is myocarditis? It's an inflammation of the sac that surrounds the heart. And what they saw was a very, very rare number of adolescent boys. Again, those are the 12 and over, somewhere between 12 and 18, had a slightly higher risk of developing that inflammation. The good news is it was a very mild inflammation and it self-resolved. And we seem to see that there are no long-term side effects. And again, as we learn more about that, we think it is also linked to something that is post-puberty and some of your androgens. So again, we're talking about hormones after puberty may put you at slightly increased risk for that myocarditis. So it's particularly for boys, particularly those who are in their teenage years after puberty. So for the 5 to 11, right, they're generally before puberty. We haven't seen any myocarditis as a side effect in any of the clinical trials, nor in these first, week of us vaccinating. We're clearly going to watch for that. But what I would say is it was something that was very mild. It's self-resolved, meaning it didn't even need any treatment. So as you weigh risk and benefit of any of these decisions, both as a parent or as a doctor, the risk for our kids are real of COVID. And I think that the risk from this vaccine is extremely low, even for our teenage boys. Again, I don't have a teenage boy, but I would have still gotten my my son vaccinated. If I did, I will say I have a number of cousins who have teenage boys, and they are all vaccinated and all did really well. So let me turn it over to Dr. Monroe, see if there's more she wants to add.
On the question of myocarditis, Dr. Monroe.
Thank you, Molly and Secretary Cohen. I agree with everything you've said. The cases of myocarditis in the adolescent male group, they were seen in the first several days after receiving the second dose, but again, still very mild. I spoke with some of our pediatric cardiologists about this who have seen a couple of cases, and they resolved with rest and Motrin. And so, mild, resolving on their own, and very rare. Interestingly, though, the risk of myocarditis with COVID disease itself is actually much higher than the risk from the vaccine. So we know with the vaccine, it is less than 1 in 40 to 50,000 versus with the disease, about 1 in 40. So significantly increased risk with actually contracting COVID and having myocarditis. I do have a teenage boy, and this information was coming out at the time that he was, eligible to get vaccinated. And it's something that, I had to think about as a mom. I have a healthy, athletic son. Does the risk of that outweigh the benefit? And for us, and for him, he was a part of this decision making. It was a no-brainer once we'd considered all the evidence that this was something that could get him back to safely entering school, participating in sports, socializing with friends, and so we were glad to get vaccinated.
And how is he doing, Dr. Monroe?
Oh, he's fantastic. He's entered his freshman year in high school, and he is healthy and well, and he's thrilled to be vaccinated and back in school because he was out all last year virtual.
As many of us know, with parents who had homeschool and kids we had to handle, that was a lot. In a different kind of town hall for a different day about the issues for COVID and how that impacted our kids. But I do think there's a lot of hesitancy over how, because you say there is some risk, and there sometimes are some things, myocarditis or something else, and that a lot of parents say, I know, but I'm just not ready because the vaccine is so fast and there's not that much research for it, is what you'll hear, at least if you're in a newsroom and you're talking to parents that say, I'm just not ready. I'm just not ready. What do you say in response to those parents? Either of you. We can start with you, Dr. Cohen.
First, I would say is remember that this is the same vaccine that millions and millions and millions of adults have gotten. So I think more than 200 million doses of Pfizer have been given out at this point. For the children, yes, it's a smaller dose, but it's the same underlying way of teaching your body how to recognize COVID. And so I think folks not only should be comforted by the trials that were in children, which I very much am comforted by the fact that there were no serious side effects, but the fact that we've gotten to see hundreds of millions of doses of this vaccine be given to adults in a safe way, that is what gives me additional reassurance, knowing how the immune system of our body works, and it works similarly when you are 5 to 11. That brings me comfort. And again, what I would say is more and more kids are getting vaccinated every day, and we get more data every day. So if parents want to take a moment, ask more questions, think about maybe 2-3 weeks from now doing that. I understand it. I'd encourage you to do it sooner than later. I know the holidays are coming up. We all want to get together. I want to also remind folks that we're going into the winter, and COVID-19 is a coronavirus and is a winter virus. So, I think we have some factors working against us here, with us all wanting to get together for the holidays, winter viruses. So I would encourage folks to go faster. But what I think tonight is answering your questions and making sure you can get comfortable. And again, talk to your pediatrician, talk to other medical providers, get good information, right? And making sure you're looking at that accurate information, and talk to others whose kids have gone through this experience and what was that impact for them.
Let's go to a Facebook question. Have you all considered doing a town hall like this with children? It would be helpful for my kids to hear this stuff from someone other than me.
I love that feedback. All right, I'm going to take that for the team. Thank you for that. And yeah, I think kids talking to other kids would be fantastic.
And what would either of you say, maybe Dr. Monroe as a pediatrician, this is more you, to parents? I have heard from parents that say, I am getting my child vaccinated, but they feel like they're going to school and their friends aren't getting vaccinated and they're almost feeling shamed by that. What kind of advice do you give parents to tell their kids on how they can respond to other kids that don't believe in the vaccine, or their parents tell them they're not going to get it, but then here is their child that is getting it?
Wow, that's a really interesting question. I think that this is a personal decision, and it's a family decision. And just like anything else that, decisions that you make for your children or that you make with your children that may not be in alignment with what their friends or what other people are doing. This is something that's personal, and one doesn't really need to be discussed with friends if there's, shaming or criticism, from other people. I would hope, though, that children who get vaccinated would be advocates and stand loud and proud and be excited to tell their friends what they're doing to not just protect themselves, but protect their friend group. Getting vaccinated is something that you do to protect other people. And so I think that's a pity if that really is happening, to children. But I always remind my kids, when they come home and tell me, well, so-and-so's mom said that they can do this or they can't do this, why can't we? And I always just say, remember, you don't have so-and-so's mom. You've got me as your mom, and the decisions we make are going to look different sometimes, and that's okay.
Each family has their own decision-making process, that's for sure. But no, there have definitely been questions from parents into our newsroom. I write a monthly column as well for a local parent magazine, and that's what parents are asking. How do you respond to your kids? What do you tell your kids? It's interesting. It is a really interesting, that's a different angle. It's not about the science, the data. It's more how you're handling the conversations with your children and the conversations they're having in schools. Here's another Facebook question. How can you state that COVID vaccines are safe for pregnant women when pregnant women weren't largely represented in trials?
Yeah, let me start with that. So I want folks to know that not only do we monitor safety data in the clinical trials, but we monitor safety data ongoing. So even as all of us are getting our vaccine over the course of this whole year, that we are reporting back safety information, and the FDA and the CDC are looking at that safety information. And we know that there's been hundreds of thousands of women who are pregnant and have gotten vaccinated and have had good pregnancy outcomes. So we can see that. And in fact, we saw so many pregnant women get super sick from COVID during this wave of the more infectious COVID that the CDC went as far to say, please, I'm putting out an advisory to tell pregnant women, please get vaccinated at any point in your pregnancy. It doesn't need to be a particular trimester. So we are monitoring that data going on. So it's not just relying on those clinical trials, it's all of the ongoing data. And we have had hundreds of thousands of pregnant moms get vaccinated. And so we can accurately tell folks about the data and the safety.
Okay, another Facebook question. What is the % of prevention of COVID with the vaccine?
I'll take that, and Dr. Monroe jump in. So I will just talk about the data that we saw coming out of the trial. The effectiveness of the vaccine was similar to what we saw in the trials for adults. So meaning it was about 90% effective at keeping kids from getting COVID. And I think Dr. Monroe said it, hit it on the nail. No vaccine that we give any of our kids anytime is 100% effective, but 90% is pretty good. So, right, I feel really good. When you're thinking about risk and benefit, right, there's a big benefit there at 90%, and then the risk being low, knowing that it's a safe vaccine. And again, that went into my thinking as a parent when I decided to vaccinate our daughters. But so we feel really good about how effective that is. I should note that, over time, two things could happen that we might need additional vaccines. We're seeing that for adults with boosters. Two things could happen. One, the virus could change. And two, we know that our immune system forgets over time, and that we need to boost it up. and we need to remind it how to recognize COVID. So I do expect, and we should expect, like the flu vaccine that we give our kids every year, we're likely going to have a COVID vaccine that becomes an annual vaccine going forward into the future. So I don't think that we've done anything wrong. That's just the nature of how our immune system and the virus changing. So I would expect that there is going to be a vaccine booster for our kids in the future. Again, that's off into the future, but again, I don't think that means the vaccine isn't working. I just think it means that the virus could be changing, and we just need a reminder as we go along.
Did you want to add to that, Dr. Monroe?
Secretary Cohen said it really well, but also keep in mind that every vaccine that we give our children, all of our childhood vaccines against meningitis and pneumonia and whooping cough and all of these different things are all vaccines that do require boosters. And so if people think about it, it's really something that we are used to doing in the world of vaccinating children. And so it makes sense that we would need to boost and remind the immune system with the COVID vaccine also.
Okay, let's move on. Ashley from Taylorsville has asked, will children need to receive booster shots, which we just talked about, and what will happen if later down the line, if my children cannot have children of their own as a result of the vaccine? And I know we talked about that 30 minutes ago, but it is something
November 9th, English Fireside Chat, Vakin as a speaker.
We're having some you guys get to hear the behind the scenes of the phone call stuff, the audio back here. I want to go back though to the fertility questions and concerns and fears over that. They're very real. You hear it all the time. You have to, both of you. We certainly hear it in the newsroom. So if you could go back to that about the booster shot, which we sort of talked about, you guys just hit on. Yes, you'll probably need one at some point. It's down the line, but then that fertility thing about the fears, especially not knowing what's coming in the future, and for girls getting the shot now.
Yeah, let me start with the fertility, and then I'd love for Dr. Monroe to also weigh in. And again, I'll just say again, I have two daughters who are 7 and 9, and I got them vaccinated. And that's because I feel 100% comfortable that there is no concern related to their future fertility. We know how our immune system works. We know how our reproductive system works. They are not going to interact in the way the vaccine works in terms of teaching your body how to recognize COVID. I think most women know you are born with the eggs you are going to have in your body when you are born, and they're still going to be there, and the vaccine is not going to impact those. And in fact, I think we've been talking about during this session how we've gone so far to say we actually want folks to get vaccinated, because if you are not vaccinated, you put your pregnancy at more risk going forward. So Dr. Monroe, anything you'd like to add?
Secretary Cohen, everything you said was right on point. We also know that, millions of people have been vaccinated, and, hundreds of thousands of women have had normal, healthy pregnancies who have been vaccinated either during their pregnancy, as they were trying to get pregnant, during the period where they were breastfeeding, after pregnancy. And so even after the clinical trials, we have lots of data that just shows that there is no negative effects on lactation, which is, breastfeeding after pregnancy, getting pregnant, or, maintaining a healthy pregnancy as related to the vaccine. On the contrary, women who are pregnant, who get infected with COVID disease can have significantly increased risk of miscarriages and negative outcomes. They are disproportionately impacted and seen represented in ICUs, intensive care units, women who are pregnant versus women who aren't. And so we know that having COVID disease plus pregnancy is particularly risky itself.
Thank you, Dr. Monroe. We have a question now. Whitney from Durham. We think the phone lines are working again. So Whitney, I'm going to call on you. And if you can hear me, you are live. Ask your question. If not, I can ask it for you.
Yeah, I'm here. Hi.
Woo! Hi.
My question is, hi, you guys talk a lot about clinical trials, and I feel like it's vague. So I would like to know more information on what are the clinical trials for this age group? I mean, are we talking 40 people? Are we talking 4,000? I just don't, I feel like, if it's really, really small, it makes it just too vague for me. So is there a specificity on that answer?
It's a great question. Dr. Cohen, why don't you take that first and then we'll go to
Whitney,
Dr.
what a
Monroe.
great question. I'm going to turn it over to Dr. Monroe because her son was actually in one of the clinical trials. So she could talk about that while I pull up the number for the total number of children who were in the trial. But she can talk to you specifically about that, and I will pull up the exact number. But it was more on the 4,000 side. I think it was actually more than that, but Dr. Monroe, you may know.
Thank you, Secretary Cohen. And that is an excellent question. So my 11-year-old son was in the Pfizer trial for children 5 to 11 years old. And the number, from what I recall, and I know Secretary Cohen is looking it up, was about 4,200 or so, but certainly more than 40. But there were sites all over the United States, testing the vaccine on children. 66% of the children received the vaccine versus placebo, and what they saw looked really similar to the adult data. More than 90% effective at preventing COVID infection and hospitalization, and the side effects looked very similar, which are mostly pain at the site of the injection, fatigue or feeling tired, fever or headache. Those are the common things that we see in adults, and about, the first dose, about a quarter of people will feel any of those things, which means people will feel nothing. I felt lucky that I had very mild symptoms. I had headache for less than 24 hours, but my 14-year-old felt absolutely nothing with both doses when he got vaccinated. And again, my 11-year-old who was in the trial, we just learned this week, unfortunately received the placebo. And so he has his appointment to get vaccinated through the trial in a couple of days. But Secretary Cohen, maybe you have more on the numbers, the total numbers at this point.
Yep. So Whitney, just to get back to you, it was about a little more than 3,000 kids were in the trial. Some of those were here in North Carolina, other places through. And just so we know, that's about a similar size trial to other vaccines. So again, I want to remind folks that not only does that data come from the trial, but we have ongoing data that we continue to collect to make sure if there is anything that we do need to learn, that we are learning it as we go.
So we have about 8 minutes left here. I just want to remind anyone that is watching or listening and you have a question, this is for you. So ask it. If you are on the telephone, press 0 on the keypad, you can get in the queue or comment on any of the social media platforms if you are watching this through social media, because we do have people looking for those questions and we want to make sure to try and answer any questions you have about the vaccine and help you feel comfortable in understanding the vaccine for kids ages 5 to 11. We have had a lot of calls about, we'll get to that I think in a minute, because we have Amy from Clemens on the phone. Amy, can you hear me?
Hi. I have a 5-year-old and a. Hi, can you hear me?
Yes, you're live. Go ahead and ask your question, Amy.
Okay. I have a 5-year-old and a 3-year-old, and my 5-year-old is actually getting vaccinated Thursday. But I was wondering what the timeline is for like 3-year-olds or 5 and under to get vaccinated.
Well, I'll take that one. Well, first, Amy, yay, getting your 5-year-old vaccinated. But I would say, so there are starting to be now ongoing trials for our younger kids. I think that's going to be a while off, probably at least another 6 months. The reason is that the younger the kids, we know that they get COVID less often, which is good. But it means we probably have to follow them for longer to make sure we really understand how the vaccine is working in that population. They want to make sure they got the dosing right. So they are starting clinical trials. And I don't know if that they're here in North Carolina, but clinical trials around the country think it's probably going to be another 6 months, I think, before we're going to see a vaccine for our youngest. Dr. Monroe, anything you'd want to add to that? No. Okay.
No, just congratulations on getting your 5-year-old vaccinated. I know that's very exciting. And I hear from moms like you who were kind of waiting with bated breath about their younger children. So I appreciate that question.
We have had some questions about, so how do you find the ages between 5 and 11? Because a 5-year-old, the development and their size, their weight is very different than an 11-year-old, but yet it's the same dosage for a vaccine. Can either of you talk about that?
Yeah, I can start with that. So the good news is this vaccine is not weight-based. Many medicines that we dose in pediatrics, we dose by weight, but this is based on the maturity of the immune system. So a small 5-year-old, a large 11-year-old, the development of their immune system is what matters. And so that the 10 microgram dose, so that's 1/3 of the adult dose, is the appropriate dose for that range of children. I've also heard people ask, well, what if my 11-year-old is close to turning 12? It'll be stronger or better. And the recommendation actually is not to wait to go ahead and get the 11-year-old vaccinated. We actually saw that there was good effectiveness with that 10 microgram dose, the 1/3 dose, even in that adolescent group, 12 plus. Mm-hmm. And so you don't need to wait for your 11-and-a-half-year-old or almost 12-year-old or large 11-year-old to get the stronger dose. They will be well protected with that the 5 to 11-year-old dose, a 10 microgram dose, and likely have less side effects.
Dr. Cohen, did you want to add anything to that? We have about 5 minutes left here. I'm going to ask you a final question, but want to make sure.
Nothing to add. That was perfect.
And the one final question I was going to have is what Amy asked. I'm glad that Amy asked it about the under 5 and what was a timeline for getting that vaccine out. Secretary Cohen, this final question is just what do you think is the most important thing that you can tell parents who still do not know if they should get their child vaccinated against COVID-19?
Well, first, I think this has been a terrific discussion tonight, so I hope this has been helpful for folks. I know it's a really important decision for parents to make, and I really respect everyone's desire to get the facts on how to best protect their children. What I would want you to take away from this is children are vulnerable to COVID-19 just like everyone else. And second, that these vaccines are safe. They've been tested, and we think that it is a way for you to protect your children from serious illness from COVID. I'll share again, as a mom of a 7 and a 9-year-old, both daughters, I got them vaccinated this past Saturday. Our experience as a family, they didn't have any side effects. Every kid's a little bit different, but that was the decision we made after looking at the science and the data. For our family, I hope folks will look at the science and the data themselves, hear from good, reputable sources of information, and hopefully make the choice that our family made, that Dr. Monroe sounds like made for her family as well, and to get vaccinated. There's plenty of vaccine. It is free. And you can go to myspot.nc.gov to find a location for that smaller dose of Pfizer for our 5 to 11-year-olds all across the state.
And Dr. Monroe, let me just ask you too, if there's, you must hear from parents saying, I'm not sure. We're saying, call your doctor. You're the doctor. They're calling you. What is it that you say to parents that say, I'm not sure?
I really appreciate people who have called in and asked questions. I think that these conversations are so important. I have these conversations every day, and I remind people that, you have trusted me and us with some of the most critical and sensitive parts of your child's life. You trusted us with your child when they were sick with fever and they were, very young, or with concerns about, their mental health or other different things that you have trusted us with. And this is the same thing. You build that relationship with your pediatrician. We want your kids to be healthy. We want them to grow up and do well and re-engage in the social environment safely. And so this is a perfect thing to talk with your pediatrician about, and trust the science and the evidence, and to not to rely on some things that we know or have spread misinformation and even some hoaxes, as we've discussed so far. So have a conversation with us, and we're glad to have it.
We appreciate both of you so much. And if anyone is watching this wants to go back to hear something again or share it with someone else, please know you can find all of this entire hour-long discussion on North Carolina Department of Health and Human Services social media accounts, NCDHHS, their social media, Facebook, YouTube, Twitter. WBTV has also been streaming this live. We're going to have it on our accounts as well. That concludes our program. And just Dr. Monroe and Dr. Cohen, thank you so much. And I feel like, Dr. Cohen, I've watched you for 20 months say this, so maybe I should end the call by taking your words, but practicing the 3 W's, right? Wear a mask, wait 6 feet apart, and wash your hands often. Do people stop you on the street and say that, 3 W's?
Oh yeah, they call me the 3 W's lady. Not so much anymore. I think we're moving past, because now I'm vaccine lady. But you know, it's great. It means that we're breaking through. That folks are working hard to protect each other. I just want everyone to stay well out there. What a great discussion, Molly. Thank you so much for moderating this, and Dr. Monroe, as always, thank you for the fantastic answers to the questions and for being a great partner through our response efforts.
I learned a lot. I'm in a newsroom all day long looking at this stuff and reporting on it, and I learned a lot. So I really appreciated your time. Thank you, guys. And again, it's back on the NCDHHS social media accounts if you want to go back and watch. Thank you all for participating. We hope you learned something.
Bye-bye.
Good night.
Good night.